This is Health Check on GH Today. My name is Nanama Ano Bempong and we are at the dental unit of Claron Health International. We're going to be speaking with Dr. Michael Awua Mensah about how your diet affects your teeth. We'll be right back. Dr. Michael Awua Mensah, you're welcome.
Thank you very much.
Okay, so today, as I said, we're speaking about how your diet can affect your teeth. Yes. But let's start with how important is oral health?
Yes, what's the first thing you notice when you meet someone for the first time?
If they are smiling your teeth.
Yes, so the first thing you see is their smile, followed by their eyes, followed by their smell, as well as their hair.
Okay.
Yes, we realize that most Ghanaians, or the average Ghanaian, would only visit the dental clinic when he or she has excruciating pain. We use the word excruciating because most of us have very high threshold for pain. So rating pain from 1 to 10, 1 being the lowest, 10 being the highest, the average Ghanaian will visit the clinic when it's about 8, 9 or 10, but 1 to 7, they can bear the pain. They visit the chemist, they prescribe some medications for them, they take it, they're fine. Second time, they go for the same medications. Third time, they visit a herbalist who gives them something to put in their mouth and the pain disappears. So we realize that most Ghanaians don't really take their oral health seriously at all.
Yeah. Yes. I think you've hit on something there, and I think that's possibly why oral disease may be a big thing in Ghana.
Yes.
Yes. Can you tell us a bit? Do you have any statistics to?
Yes. According to the World Health Organization, WHO, oral diseases are the most common non-communicable diseases in the world. Yes. They affect us in so many ways. They cause pain, they cause disfigurement, they cause discomfort. In extreme cases, if the patient is immunocompromised, it can cause death. And one study...
Wait. Wow, really?
Yes. If you're immunocompromised, infection could cause death.
Okay.
Yes.
Okay.
And one study carried out in 2016 by the Global Burden Disease Survey in 2016 stated that oral diseases, in particular tooth decay, affected half of the world's population. That's about 3.58 billion people.
Wow.
Yes, yes.
Wow, that's really serious.
In their lifetime, yes.
So, okay, if that's the case, it affects so many people. That means that if it's half the world, then it would affect half of Ghana as well.
Possibly.
Something like that. So what are
even more.
What are the types of foods that we should or shouldn't eat that will affect our teeth?
Okay, so certain processed foods, we term them refined sugars. They're one of the major culprits for tooth decay.
Refined sugars such as?
Carbonated drinks, for instance, could cause that. Snacks, chocolates, biscuits. The sugars are quite refined, and the bacteria in the mouth prefers those sugars over the natural sugars. It's able to break them down quickly to produce acids that damage the teeth.
This one day I will not eat anything again. Okay, so we shouldn't take any, or we should take less.
Take less. The frequency is important, and also the time at which you take such sugary meals. It's preferred you take them immediately after a main meal. At that point, there's adequate saliva in the mouth, and saliva has a role of protecting the teeth, buffering the acids in the mouth. So taking it in between meals, saliva is at its lowest concentration, and you don't have the full protection against those acids produced by the bacteria. So
it's like if I've eaten, maybe I've had my banku and tilapia, I'm finished and I can take some toffee.
Yes,
or something like
immediately.
That. Immediate. Wow. Okay.
Yes.
Rules and regulations of teeth.
You don't take it in between meals. At that point, saliva is at its lowest concentration. So you're not able to buffer or act on the acids produced by the bacteria.
Okay. Yes. So I shouldn't eat sweets, biscuits, crisps.
You could, but it should be after a meal.
The time in which
sweets after meals.
Okay. So you told us about the things that we shouldn't, or the times in which we shouldn't eat certain foods like refined sugars.
Yes,
my favorite. So what type of foods would you say would be better for our teeth?
You can replace these refined sugars with fruits. You know, certain fruits are quite sweet, mango, apple, grapes. They're very sweet, but the bacteria cannot break down those sugars. They prefer the processed ones.
Okay, why is that?
That's how the bacteria is actually made up. It's able to break down certain processed sugars like sucrose compared to other sugars that's found in fruits and vegetables.
Okay. Yes. So fruits and vegetables. What about actual foods like obviously our diets in Ghana is mainly corn, millet, rice, and those kinds of food. So do those help us or not? Or what times of the day, like you mentioned earlier, should we be taking them?
The fiber foods are actually good for the development of the jaw.
Okay.
So I would prefer that you take more of the fibers, more of the vegetables and the fruits, and less of the processed meals.
So what about things like acidic fruits? Because a lot of people have tried to diet, in quotes, and that we've been told things like cider, apple cider, vinegar and things like that can cleanse and things. So sometimes I think then a lot of the time we are looking at our bodies and forgetting that it passes somewhere before it enters. So what are the things that we can do? Yes,
so the mouth is the gateway to most of the foodstuffs that we take.
Okay.
For instance, lemon is one of the acidic mediums that we usually take. And lemon tends to be very acidic. It's close to the pH of 2 to 2.2. And that's almost like what the carbohydrate acid pH is.
Huh? Wow.
Yes.
Okay.
Yeah, so taking lemon juice, for instance, it's good, all right, but I prefer you use a straw. So it goes straight into your throat, but doesn't come in contact with your teeth. Because when it comes in contact with your teeth, it's able to degrade or erode the outer protective layer of your teeth. That's the enamel.
Okay, so I used to do that with Coke, and people used to laugh at me. Because I was like, I want my teeth to remain a nice colour. Okay.
So you take those mediums with a straw.
Okay.
Yeah, so it doesn't come in contact with your teeth.
Okay. And then what about brushing? Because I was told that you're supposed to brush immediately after you've eaten, obviously to remove the particles and things like that. Is it okay?
That's actually a myth.
Oh.
Yes, brushing should be done about 30 minutes to 1 hour after eating. You don't brush immediately after eating.
Okay.
Yes. Yes, it's because there's something called an acidic challenge. After eating, you have certain minerals leaving the teeth, and it's the responsibility of saliva to put them back into the teeth. That's one of the main functions of saliva. So if you brush immediately after eating, you disturb the whole process, and your teeth become a bit brittle over a period of time.
Wow, there's so much to think about. I mean, so what would you recommend for somebody who wants to get straight with their teeth? Maybe over a period of time they're feeling a lot of sensitivity and things such as that. What would you recommend? Like maybe if you say in the morning do this, in the afternoon do this, in the evening do this, that kind of process, so that the viewers can know what to do.
Yes, so you should be brushing your teeth twice daily, at least twice daily, with a fluoride toothpaste. Fluoride, because fluoride is a naturally occurring mineral that it plays in toothpaste to help protect your teeth from tooth decay. Okay. So I advise that whenever you buy toothpaste, you check on the box, the ingredients section, and make sure there's fluoride inside. And you should be flossing your teeth at least once daily, because the bristles of your brush are able to get in between the tight spaces of your teeth. Hence, those areas need to be cleansed. So you should be flossing at least once daily. And
does that matter if it's in the morning or in the evening?
It could be at any time.
Okay.
And even after eating, if you feel you have food stuck in between your teeth, I prefer use a floss instead of a toothpick. Because with a toothpick, if you're not too careful, you may prick or injure your gums in the process and start bleeding. Okay. Yes.
Okay. So then after that, after the brushing in the morning, and maybe if you decide to floss, then what again? And
also swishing and swallowing. After having a meal, you can get a cup of water, use it to swish your mouth and then swallow. It will go a long way to help you. Also cutting down on the refined sugars. As I stated earlier, I can't overemphasize that. You should be doing that.
The swishing and the swallowing, does that mean that the things, because I would think that you would have to spit it out rather.
No. For instance, certain sticky foods like bread and pie, they tend to be sticky and they adhere onto the teeth surfaces very easily. So swishing your mouth helps the food to come off the surfaces of the teeth and you just swallow it. Doesn't really cause any problem.
Yeah, well, I'll just... Anyway, okay.
Yes,
and then...
you should be seeing your dentist every 6 months for a routine checkup and also for cleaning. Okay.
Yes. And then in the evening, before bed, obviously, like you said, we brush. And then is there anything else that we should also be doing?
Yes, so when you brush, the technique is very important and the bristles of the brush is very important. Okay. Most Ghanaians feel that you only use a hard brush to take off stains from your teeth, and that's wrong. There are so many hard bristled toothbrushes on the market, and we should not be using the hard brushes. You should be using a soft or a medium bristled toothbrush.
Okay.
Yes, the hard brush is not advisable. Also, the technique used to brush your teeth is very important. And you should also brush your tongue all the time.
Yes, the tongue brushing is it's a big thing.
Okay, with the brushing, it's best you angle the toothbrush at 45 degrees to the gum line, and you brush in circles.
Okay.
That's the best way to brush, in circles.
Okay. Is that so that it lifts up?
Yes.
Okay.
Yes. When you open your mouth, the insides of your teeth are very, very important. Most people ignore those areas.
Okay.
In those areas, you're supposed to sweep up to take off some of the deposits there.
Okay.
You do that for the top teeth too as well.
Okay.
Yes, and then the surfaces used to chew on food too is equally important. You brush on those surfaces.
Okay.
You brush on these surfaces as well. And last but not the least, the tongue. The tongue is very important. But with the tongue, you take the brush to the back and you keep pushing forwards to push the bacteria and germs out. And there are certain toothbrushes that have these dots at the back, you notice.
Yeah.
Yes, they're also for the tongue.
Okay.
So when you're done brushing this way, you turn it and also use it on the tongue.
Okay.
If the type usually has coatings on the tongue, after brushing the tongue, you use this called the tongue scraper to scrape off the coatings off your tongue.
Is this yours?
No.
Okay.
They're just samples.
Okay.
Yes.
Okay.
And you should be flossing at least once daily. I also demonstrate the flossing.
Okay.
So the flossing, there are actually two types.
Okay.
There's the one in the box and there's this one called the floss pick. So the one in the box, you open it, you pull out a long thread, you tear it against the metal here, you wrap it around your fingers and you go in between your teeth.
Okay.
And with this, it's already on a handle. So you can use any of them depending on your manual dexterity. So for instance, in case you're flossing between these two teeth here, you don't just go in straight to the floss and come out. If you do that, you may injure your gums and start bleeding. So you first go at an angle targeting this tooth. You go towards it like this, a little bit beneath the gum line. Okay. You wrap the floss against the surface of the tooth there, and then you drag it out. You go in between the same space, but now targeting this tooth. You go towards it like this, a little bit beneath the gum line. You wrap the floss against the surface of the tooth there, and then you drag it out. So you're actually cleaning the surfaces in between the teeth. Okay. Yeah, so you shouldn't go straight. If you go straight, you may end up hitting the gums and you start bleeding. That's why people complain that when they floss, they bleed. And brushing your teeth and tongue should take you 2 minutes to 3 minutes to brush. Some people take 10 seconds, you're late for work, they do a quick maneuver. Mercy, Lord. Others will take as long as 10, 15, 20 minutes. If you're 2 houses away, you may think they're scrubbing their bathroom terrazzo. That's also terrible. So you take adequately 2 minutes to 3 minutes should be fine.
This 1-2 timer.
Yes.
I see. Okay. Okay. So what about the gum? Yes. Because like you were mentioning about the bleeding of the gum sometimes, sometimes it gets some sensitivity in the gum and things like that. So how can we avoid that?
Okay. One of the major causes of bleeding gums is what we refer to as plaque. Okay. Yes, so plaque is a sticky film of germs or bacteria that form on the teeth when the brushing is inadequate in some areas. The oral hygiene is not up to its optimal level. When it stays there for long, it becomes extremely hard. When it's hard, the British call it calculus, the Americans call it tartar. And at that point, when it's hard, you try using your toothbrush to take it off, it's not able to go. Yes, and this same plaque and calculus irritates the gums. So that irritation causes some parts of the gums to get mildly swollen. So you're brushing your teeth and the bristles touch the gums. That's what causes the gums to bleed. So least trauma to the gums causes the gums to bleed because they are being irritated by the plaque deposits and the calculus deposits in the mouth. So with the plaque calculus deposits, how do we avoid? Is it just literally as you were showing us with the brushing of the teeth and the flossing that will stop that? Or? Okay, so with plaque is in its soft nature. With plaque, you can use your toothbrush to take it off, but once it becomes calculus or tartar, you need to see your dentist and have routine cleaning done to take off those deposits. Okay. So tooth decay, what exactly is that? Does that mean that your teeth are falling out, or it's gone green or black or something? Okay, so tooth decay, as we scientifically term dental caries, it's a reversible process whereby the bacteria in our mouth feeds on processed sugars to produce acids, and these acids damage the hard layers of the teeth. That's the enamel and the dentine, and as the process continues, that's when you start to feel pain. It starts as sensitivity, moves to pain. It becomes pain that you cannot bear. You're not able to sleep at night, and also you can't even chew in that area. Yeah, so tooth decay is more or less a reversible process because of such such bacteria breaking down the sugars in your mouth.
Okay, and how can you see if one has tooth decay?
Okay, tooth decay is mainly diagnosed by the dental surgeon, a trained dental professional. We're able to locate tooth decay before the tooth decay even cavitates or develops into a hole. Because there are instances that you can have tooth decay on the tooth, but it hasn't broken down or, let's say, developed into a hole, and we can actually do certain procedures to salvage the situation.
Okay,
yes.
So like you said, it's reversible?
Yes, it's a reversible process.
Okay.
Yes.
Okay. Dr. Michael, thank you so much for your time.
You're welcome.
We're really grateful.
You're welcome.
That's been us on Health Check on GH today. My name is Nanama Anobempong. We have been at Claron Health International with Dr. Michael Awua Mensah, and we've been talking about how diet affects your teeth. See you again next time.